are joining today. I hope at least some of you are Zooming from outside. A pretty nice day. And I just want to thank everybody for joining and thank Burgundy and Coffee for all the hard work they've done behind the scenes to get this organized. So I do have one disclosure, which is the book that I published last year, and I do get royalties from that book. In terms of learning objectives, three things that I really hope to cover today are to help you recognize the role of attachment in healthy development, some ideas about how to promote healthy attachment, and then some ideas about resources for addressing parent-child relationship difficulties. So one of the things that I'm going to have you think about as we move through this talk is what lens you use for viewing parent-child interactions and addressing problems. So basically the idea of working models of attachment is that we all have a particular lens that we bring to how we think about and view interactions. And so basically, just take a few seconds to reflect on how your own family of origin, the community you're in, and your experiences as a provider shape your view of parent-child interactions. So what we know about attachment from the research on attachment theory and studying attachment is that our relationships with attachment figures influence who we are, who we become, and our lens for viewing the world. So that basically early attachment relationships and ongoing attachment relationships color everything about the work that we do. Mary Ainsworth, who I consider sort of the mother of attachment theory, has this quote that attachment is a deep and enduring emotional bond that connects one person to another across time and space. And what we know, again, is that the relationships with attachment figures provide the foundation for emotional regulation and behavioral regulation. So when we think about the power of attachment and why attachment is so important, we know that it's really the foundation for developing those critical regulatory skills that can go awry when there's problematic attachment. So how to promote healthy attachment? I really came to research on attachment theory and interest in attachment theory, thinking about problematic attachment and what happened when attachment relationships go awry. But what I've gotten out of studying it was learning a lot about how prevalent healthy attachment is and how we can promote it. I like this quote from an attachment researcher that humans are a weed species. And the last time I shared this quote, somebody said they're like mint. That's exactly right. If you've ever had mint in your yard, humans are just like mint. They grow everywhere. And the reason that humans are so successful, I mean, there's obviously several reasons but one of our evolutionary advantages as humans is our dependence on relationships with others for survival. So basically, more so than any other species, we are born to be in relationships. And it's that ability to be in relationships that allows us to adapt to a wide variety of environments, including a wide variety of caregiving environments. So even as we talk about how to promote attachment relationship, I think it's important to think about the different ways in which caregiving can be effective. Okay, I just noticed, am I supposed to start my video? Oh, yes. Sorry about that.
Yeah, I wondered if you wanted to be on camera, but I thought maybe you'd preferred not to. So
no, I didn't realize it was on my end to do that. So it's weird. I'm so used to doing Zoom presentations that I felt like I wasn't really interacting with people when I couldn't see myself. Okay, I don't know what that says about attachment, but anyway. All right, now you can see me. And I can see me. So one of the ways to promote attachment is to know about this theory that's been researched quite a bit in attachment called attachment priming. So the idea is because we are all, because humans all have this inborn facility for attachment relationships, is that we can what's called prime affiliative and attachment behaviors by focusing on conditions that set the stage for those behaviors. So let me tell you a little bit about one of the research studies that came out, well, I guess more than a decade ago now, that I found just really fascinating and really helped me to think about this idea of attachment priming in young kids. And it's, as you can see from the title tells you what they found, which is that attachment priming improves pro-social behavior in 18-month-olds. So there'd been quite a bit of research in adults in attachment priming before this, but this was one of the first ones in very young children. And let me show you what they mean by attachment priming. So it's a very simple prime. So they showed these 18-month-olds 4 different pictures, and this is what's called the attachment prime. So all of the pictures that they showed had this, the control was that they all had this teapot, but then next to the teapot, the attachment prime was that they had 2 little dolls facing each other. The control conditions were that they had a little doll by themselves, 4 blocks, or 2 little dolls that were facing apart from each other. And then following, showing these simple little, pictures, they set up a situation where they looked at the child's pro-social behavior and specifically how helpful they were to an adult. And what they found was a dramatic impact, that basically the 18-month-olds who were shown the picture that had the 2 little dolls facing each other were much more likely to be helpful to an adult, to engage in altruistic pro-social behavior than the ones who were shown pictures that didn't prime the attachment system. So one of the things that this research really taught me is that one of the ways that we can promote the healthy attachment is to harness that universal need for attachment. In other words, any ways in which we can kind of tap into what's already there, the need to connect and the need to have healthy attachment relationships is going to promote healthy attachment. So most of you are probably doing some of this, so I just want you to take a few seconds and kind of look around and think about what are some examples of attachment and positive child interactions that you have in your practice setting. In what ways do you already promote healthy attachment by the kinds of pictures that you have in your waiting room, or the kinds of pictures that you have that show positive parent-child interactions? And then the other thing that I want you to think about is, how does your practice setting promote positive caregiver-child interactions? One of the things that we talk about in intervention with young kids with disruptive behavior is what we call compliance-friendly environments. Another way I think about it is kind of extreme baby-proofing. In what way is your practice setting set up so that it facilitates parent-child interactions? Because I work primarily with kids with disruptive behavior, mine is pretty extreme in terms of I just have very few things that kids can get in trouble for getting into. And it has almost a magical effect in terms of the positive impact it has on interactions. Parents will talk about, how their child is better behaved when they come in to see me, just because there's fewer opportunities for the parent to need to set limits. There's been a lot more research in terms of security priming in adults than there is in kids. And the results are similar in terms of what we know is that particular attachment primes, like pictures of a positive interaction between a mother and child or a father and child, have been used for security priming. Another thing that's been used is to ask adults to remember a positive experience with attachment figure. It's found that just by having them sort of recall a time when as a child, an adult had a positive interaction with them, they become more responsive to their child. And again, what we know about attachment security priming in adults is just like with children, we find it results in more generosity, more pro-social behavior, more responsiveness to their children, and a more positive mood. So again, thinking about how in your practice setting you might use attachment security priming. Again, think about what is it in your practice setting that provides a child-friendly and parent-friendly environment that already promotes attachment. In other words, what are you already doing that helps parents and kids to have a more appropriate, more positive attachment relationship when they're in your setting? And one of the things that I think it's important to remember is that I love this quote from John Bowlby, that if a community values its children, it must cherish its mothers. That really one of the ways in which we promote healthy attachment is by supporting parents. One of my research studies was based on research that was done in the Netherlands. And it was interesting to me because I had not, before I did that research, I had not thought a lot about how the ways in which the community supports parents or doesn't support parents. And another quote that I really like is, "Do unto others as you would have others do unto others." So that basically as providers, part of what we're trying to do is to provide for parents what we're wanting them to provide for their children. So in other words, we really need to think about how we can support parents by developing healthy attachment relationships with them. And this is another quote that I really like by Howard Steele. And part of the ways that we support parents and support healthy attachment relationships is, as Howard Steele says, it's our job as early childhood educators and parenting researchers to assure new parents that attachment is a process, not dependent on any single event or specific parenting practice. What I find so interesting about this quote is that it came at the end of a book that was about a number of specific parenting practices. It was about how to promote things like co-sleeping, how to promote things like breastfeeding, and there were a lot of great ideas in the book about how to make that easier for parents to do that. But what I really liked about this quote is it really brought it back to the idea that often there are a lot of challenges for parents in terms of doing specific practices. And that part of what we need to do is that even as we promote specific practices, is to assure parents that that attachment is a process, and that, you know, if there were things that happened during early childhood that they wish could have done different, it's not too late to develop a healthier attachment relationship. And the specific things that I think about in terms of supporting healthy attachment is that parents need to be heard, seen, and what I call heard, seen, and appreciated. Because what we really want them to do is to hear, see, and appreciate their children. And that as providers, we need to be able to provide them with that type of relationship. And I'm thinking yesterday of a talk I had, a conversation I had with a fellow provider about families that we share. And there was one family that when we talked about them, we both kind of beamed and talked about, you know, how wonderful it was to work with that family. Those are parents that are easy to hear, see, and appreciate. And then we talked about a family where it was more of a struggle, where hearing, seeing, and appreciate the parents took more of an effort on our part. So one of the things that I think is also important to keep in mind as we're trying to support parents and to support healthy attachment is that we are maybe the experts on best practices in parenting, but they are the experts on their children and on their family. And so even as we try to think about supporting best practices, we need to be mindful of the parent's unique role in determining what is best for their family. And another way to focus on promoting healthy attachment is to focus on the moments where the parent is responding to the child's cues. So what we know about attachment theory is that healthy attachment is built on these building blocks of thousands and thousands of moments of the parent responding to the child's attachment cues. So the parent picking up a crying baby, smiling back when their child smiles at them, reaching out their arms for the parent, all those kinds of cues that the parents do over and over again in terms of meeting their child's needs. You may often see them during an appointment, and the ability to just notice and sort of slow things down in that moment so that the parent knows that you know that you notice them responding to their child's cues. It can be a really powerful way of promoting healthy attachment. And then another way of promoting healthy attachment is just to let parents know that you see what a fabulous job they are doing and I say fill in the blank, responding to their child's cues, asking for help, coping with sleep deprivation. I'd like to say that I put this in because of Dr. Emmons' talk, but that's actually not the case. The reason I put this in is that we did some research a few years ago where it turned out that one of the factors that determined parents' ability to feel good about themselves as parents was their ability to cope with sleep deprivation. This was in research on parents of newborns. So, although it probably applies across the lifespan. So what is healthy attachment? Again, the more we can kind of recognize and point out to parents when we see a healthy attachment relationship, the more we can promote healthy attachment. When we think about healthy attachment, it's really a balance. It's a balance between those those two functions of growing up, which is being in relationship with your parent or attachment figure and going out and exploring the world. So a healthy attachment relationship, in a healthy attachment relationship, the parent provides what we call a secure base or support for exploration. So they support their child in going out to explore the world. And healthy attachment also provides what we call a safe haven. So it provides support for seeking proximity and comfort from the parent when distressed. So we want kids to be able to go out and explore, but we also want them to be able to come back and use that parent as a safe haven for dealing with distress. And in attachment theory, we talk about what are called organized patterns of attachment. So we talk about secure attachment relationships, what are called ambivalent resistant, and what are called avoidant. So in secure attachment, and there's probably no attachment relationship that is perfectly balanced. But in a secure attachment relationship, what we're really looking for is a balance between that focus on independence and that focus on relationship. So what you see in these kinds of relationship is a parent who encourages their child to kind of go out and explore and play with the toys in the waiting room, interact with other people, and a balance between being able to come back to the parent when they get stuck or need help. In what's called an avoidant attachment relationship, the parent and child are very focused on exploration. They're very focused on the child being independent and doing things on their own. And there's less focus on the child, on the parent-child relationship and the parent and the child being able to seek out support from the parent. In an ambivalent resistant attachment relationship, there is a lot of focus on the relationship. These are the kinds of relationships where you might think of the child as being somewhat clingy, as having difficulty doing things on their own, and less of a focus on being able to do things on their own. Okay, I just got to turn my air conditioning quick. I'll be right back. I turned it down because of the noise, but I'll try to speak over it. And another kind of, so once research started being done in more clinical populations on attachment, we found another type of attachment, which is called disorganized attachment. And so I'm going to talk a little bit about disorganized attachment and some of the factors that go along with that. So what we know about certain things that they have what's called a disorganizing effect on the attachment relationship. So we know, for example, that loss is disorganizing. So when you have organized your functioning around a caregiver, around a parent, and you lose that parent, it's profoundly disorganizing because you no longer have that person that supports you going out and exploring, or that person who helps you manage your distress. So loss in and of itself is disorganizing. We also know that maltreatment is disorganizing. So Burgundy mentioned the number of children who've experienced maltreatment. And again, we know that having a caregiver who has abused or neglected you is also disorganizing, because it puts the child in this situation where they're basically stuck between a rock and a hard place. Again, we are hardwired to go to our attachment figure for support. And if that attachment figure has also been harmful to you, then you're stuck in the situation where everything in you is telling you, I need to go to that person for support, but you're also feeling like that person is scary and that person might hurt me. And so what you see, what we mean by disorganization is that the attachment relationship kind of breaks down at times. So the child will start to go to the parent for comfort, but then they might kind of back away from them, or they might go to them for comfort, but then look briefly kind of worried or scared. And then lastly, having a parent who's clinically depressed or has their own history of trauma can also be disorganizing. So in these cases, again, it's the situation of having somebody who is in charge, who's supposed to be taking care of you, who is reacts in a way that seems like they're overwhelmed by you. So the child may want to go, again, the child is biologically primed to want to go to the parent for support, but because the parent looks overwhelmed when they try to seek support from them, they're stuck in terms of being able to seek support. So the thing to keep in mind is that secure attachment is a protective factor, and insecure attachment, especially disorganized, is a risk factor. But this doesn't mean that every person in a secure attachment relationship doesn't have mental health problems, or that every person who has insecure attachment does. So again, we think of it in terms of risk and protective factors, and kids who come in for help, for example, with disruptive behavior, oppositional defiant disorder, many of them do have a secure attachment relationship. It is an important protective factor in terms of the treatment, but it doesn't, again, these aren't 100%, again, these aren't diagnoses. They come from the developmental literature, and so rather than diagnoses, we talk about them as risk and protective factors. So again, in terms of promoting healthy attachment, keeping in mind that secure attachment is the norm. It is the most prevalent in terms of community samples. And so again, part of thinking about, in terms of the lens that you bring to working with families, thinking about how can you look for security? How can you find security? And how can you recognize and support moments of secure attachment and healthy functioning? And this sounds kind of easy or basic, but most of our training as clinicians is to look for problems. We're really trained in terms of looking for problems. And at least for me, what I've gotten out of studying attachment theory and research on attachment theory is learning how to look for what's working and how to look for moments of secure attachment and healthy functioning. And then, of course, we also have to respond to parents' concerns, because even as we're recognizing and supporting what's going well, they come to us because of concerns about how things are going. And so we also have to have ways of responding to their concerns about their child's emotional development and behavior problems. So keeping that in mind, I want to talk a little bit about about referrals for parent-child relationship problems, how we can both promote healthy attachment, but then respond to parents' concerns. And sometimes that may mean making a referral to address the parent-child relationship problems. And as I said, the particular way that I approach this is thinking about how to harness the power of attachment to address parent-child relationship problems in young children. So again, my focus is really on attachment as a solution. how is it that we can take what we know about the importance of attachment relationships and use that to address the kinds of relationship problems we might see in parents and young kids. And as was mentioned at the beginning, the specific approach that I do training on is called Iowa PCIT. It's a version of parent-child interaction therapy. And I put the link to the website here. You can also just Google University of Iowa PCIT. And on that website, I've got lots of handouts. I'll show you a couple of them, and also a list of providers who've been trained in this approach. And this is an approach that was really developed for kids with disruptive behavior, with diagnosis of ADHD, oppositional defiant disorder, and has also been used extensively with kids who have disruptive behavior in the context of being traumatized due to maltreatment. So it's been used with kids in foster care. It's been used with parents who have been physically abusive or neglectful. And there are two phases to the approach. The first approach is what's called child-directed interaction, where we focus on teaching the parent to follow the child's lead. So we really focus on teaching parents how to be more responsive to their child and their child's cues. And then the second part is what's called parent-directed interaction, which is where we focus on teaching the child to follow the parent's lead. So we really then, at that point, focus on teaching parents how to set limits, how to give the child effective commands. So with child-directed interaction, the focus is the idea of the most precious gift we can offer anyone is our attention. So the idea, again, is that kids are hardwired to want to be in relationship with their parents and to want their parents' attention. And how can we use that precious gift? And the second part of this quote is, when mindfulness embraces those we love, they will bloom like flowers. So again, the idea is, how can you enhance that relationship in such a way that you will be able to see the child's best potential? And these are the specific skills that we focus on teaching parents and then coaching the parents in. They're called the pride skills. And these handouts, again, are available on the website. And you are welcome to use these handouts with parents. I, of course, think it's especially helpful when we're able to coach parents. The approach we use ideally is where the parent has a bug in the ear and we're watching them either over telehealth or behind a one-way mirror or over cameras. And we're able to coach them in using these skills with their child in real time. But I think just even knowing about these principles can be helpful for parents. And so the specific things that we teach parents to do is to, first of all, give specific praise for positive behaviors, to reflect back what the child says, to imitate what the child's doing, to describe what they're doing. And then this is all designed to help to get the parent and child relationship to a point where the child is able to enjoy and relax and delight in their child. One of the things that we know is that's an important component of building a healthy attachment relationship is parents just enjoying their kids. And of course, if you have a child who has a lot of behavior problems, it's difficult to enjoy your child. And so teaching parents some specific skills and way of attending to their child can, we hope, bring the enjoyment back into the relationship. And this is probably for me, this is the most important takeaway from this talk for you guys, is that I want you to really think about how you talk with parents about their attention, and think about how to focus on the power of their attention instead of what I often hear described as negative attention-seeking behavior, or just doing that to get attention. When we talk to parents about things being attention-seeking or kids just doing things to get attention, to me, it evokes this negative idea about the children's need for attention and their attachment needs. And it can also make parents somewhat defensive, as it implies that they are not giving their child enough attention. And so instead, I really try to talk with parents about the power of their attention and the importance of their attention and how it is tied into what we know about the attachment system. And then the second phase that we focus on in Iowa PCIT is what's called parent-directed interaction. So I think in recent years, there's been an emphasis on attachment parenting and gentle parenting. And sometimes in that movement, we've kind of lost the idea of the importance of parents being setting limits, and parents teaching their kids to accept limits. So going back to Mary Ainsworth, who again considered sort of the mother of attachment theory, and her quote is that there is a point toward the end of the first year of life or early in the second year when a baby's confidence in being able to control the world through his own actions is well enough established that parents can begin to show him the limits of his power. So again, the idea is that it's really important for parents to be responsive and to do that child-directed interaction, but parents also need help in learning that they need to teach kids the limits of their power and to set boundaries. And in parent-directed interaction involves a series of steps that we use to teach the child to follow directions. So consequences are introduced gradually and with the focus on the child and parent feeling successful. And then we have them do what we call listening practice at home to reinforce the importance of the child learning to follow directions and the importance of the parent's role in helping them learn to do that. So referring parents for parent-child relationship problems. So I think referrals for parent-child relationship problems are most useful when the referral addresses the parent's concern so that the parent feels heard. And the referral is provided at the time the parent wants help so that the parent feels that their concern is taken seriously. And then finally, and I think this is the most important point, is that the referral expands the network of support and guidance for the parent. One of the things that I think is really important is for referrers to realize that they're continuing to be part of the support and guidance for this parent, and that the parent feels like they have support in developing a relationship with another provider, so that they're gaining attachment relationships and support rather than feeling like they're losing support from a provider. And in terms of resources, again, just to reiterate that there's a list of people who provide this intervention, as well as the manual and handouts and PowerPoint slides at the Iowa PCIT website. And then I have this book if you want to dive into more detail about how to do sort of an attachment-informed approach to working with parents, as well as I put my email in case people want to email me after to follow up after this.
Thank you, Dr. Troutman.
Yeah.
We'll take a couple questions.
Okay.
Any advice on how to access PCIT? I called one of the providers and I was sitting in this week, and their wait list for PCIT is 2 years.
2 years? Oh, sorry. You know,
I know that's a hard one with a shortage of
yeah, it's
providers. Yeah.
no, I was going to say it's a hard one, and it's one I haven't figured out. In terms of, I mean, it's in some ways it's the more people I train, the longer the waiting lists get. So okay, I will say that. Okay, I hate to say this because I know this is being recorded. You
want me to hit pause? No.
No, yeah, I do think there are some people who have openings now. I'm just not sure. I'm just not sure who.
And I can let you address this one if you wanted to follow up later with an answer too.
Oh, yeah, that's probably a good way to do it. Yes.
Okay, thank you. What resources do you provide parents considering a strict every 3-hour feeding schedule for a newborn? Does it have an effect on attachment?
So one of the things that I've learned when I get questions like this, I have to say this is not one I get that often, but the one I usually get is about fussy, about fussy baby protocols and things like that. One of the things that I've learned is to ask parents a little bit about to kind of dig underneath it and to say, what do you mean by a strict, feeding schedule? I mean, in terms of effects on attachment, at the time Mary Ainsworth started doing her research, strict feeding schedules were much more in vogue than they are now. And I don't think the rates of secure attachment were much different at that time. I mean, it is responding to your child's feeding cues is obviously one of the ways of being responsive to their attachment cues. And so I think it's one of those things where just being curious with the parent about why they want to follow a strict feeding schedule and what it means to them is probably the way I would go.
Great, thank you. Can you explain what the disorganization spiral is and how it affects professionals?
Yes. Okay, I didn't even talk about that. This is somebody who's already very knowledgeable about the disorganized spiral. So yeah, thank you for asking me that question. So the idea of just this disorganized spiral is that what we know about disorganized attachment is that it's like it's unmitigated anxiety, because you can neither kind of go to the parent, because you can't go to the parent to manage your anxiety, but you're hardwired to go to the parent to manage your anxiety. You just have this kind of this overwhelming sort of anxiety. And what we know about anxiety is that it's contagious. So when we're working with families where there's disorganized attachment, it tends to spread to the professionals, and we tend to feel anxious in terms of our response to working with them.
Great, thank you. What are some examples of day-to-day things that parents can do to support healthy attachment?
Oh, I love that question. The way somebody asked me this the other day is, what are attachment hacks? And I at the time I was like, attachment hacks, what do you mean? But then I thought about it and I was like, I know what from my perspective, the attachment hack is 3 to 5 minutes of focusing on your child. I think the attachment for kids who are old enough to do play with, the attachment hack is 3 to 5 minutes of just seeing, hearing, and appreciating them through doing child-led play. For younger kids, for babies, the attachment hack is wearing your baby.
Yes. Great suggestions. What are your recommendations for setting up a physical environment, such as a waiting room, in order to support positive parent attachment priming?
Well, so first of all, pictures of parents and kids having a positive interaction. So, father and kids, mother and kids having a positive interaction. The other thing is, as I mentioned, is as much as possible, kind of what I think of as extreme baby proofing. So in terms of looking for space to I'll just give you the advice that I give when, looking for space to do the intervention that I do, which is that I say, go into the room, look around, think about the most disruptive 3-year-old you've ever dealt with, and think about what they could do in this, think about what they would do in this room that would need to have limits set. So again, as much as possible, trying to reduce things where parents will need to set limits is another thing that, I think that's a little harder than putting up pictures that promote attachment priming, but I think that's another thing that really helps to promote positive parent-child interactions is if it's an environment where parents don't feel like they're needing to set a lot of limits. I just thought of one other thing that I say that I sometimes talk with parents about that I'll share with you guys is creating what I think of as kind of a spa environment. So like not having it be too overstimulating. So not having too many bright lights and too much sort of too much going on.
Great recommendations. There was a similar question on recommendations for attachment priming in the classroom.
Oh, wow. I've never thought about this before. Attachment priming in the classroom. Again, the focus on things that sort of promote positive interactions. And I will say that one thing in terms of, so for example, if this is not so much attachment priming, but more just trying to think about how to promote pro-social behavior. Rather than, like, if you have classroom rules in your classroom, things that focus on what to do rather than what not to do. So like be kind rather than don't hit. Would just be like, kind of an example. And then, but I think in terms of attachment priming, the same kind of things would fit in terms of having pictures of kind of positive interactions. And the other thing that I will say in terms of classrooms, just thinking about this, in terms of thinking about resilience and positive and the importance of attachment relationships, some of the parents that I've worked with who've come from really challenging backgrounds, when I ask them that question about a positive attachment figure, it's often been a teacher. And so I think, one of the things that I think about is that whoever asked that question is probably already, if they're a teacher, they're probably already doing a lot of these things to promote healthy attachment.
Yeah, and teachers spend so much time with kids that there's definitely that attachment there. Do you have any thoughts for or against the Baby Wise books approach and how it may affect attachment? If you're familiar with the Baby Wise book. I'm not familiar with Baby Wise. Okay. I'm not either, but this is one we might just do a little digging into and then answer later.
Yes.
Can you talk about the role of animals in helping to form attachments? That's an interesting one. That's thinking attachment to pets and
right.
On there.
The first thing think about, I mean, so in terms of, I mean, in families who have healthy attachment relate, well, so what I found in my research is, because I was going into a lot of homes of parents of newborns for my research, and we were videotaping parent child interactions, and it was so interesting to see that in families where there were these really where they were healthy attachment relationships, you also saw really positive behavior between the pets. The pets were often wandering into the videotaping, and so I got to see the ways in which parents sort of promoted healthy attachment, not just in terms of how they responded to the child, but how they helped the child respond to the pet. But yeah, I don't know. I can't think of any research in particular on pets and attachment.
Okay, one more question. How to reach an adolescent with a loss of a father, has anxiety, and treating with medication?
And the question is how to
reach an adolescent with a loss of a father, has anxiety, and they're treating with medication.
Okay. I think the thing about loss is that people are ready to talk about loss at different phases, and not necessarily when we think that they need to talk about it. And so I think the main thing is that when you have an ongoing relationship like that, just continuing to focus on your attachment relationship and giving them a place and a space to bring it up when they're ready. That would be my advice. I can think of a couple of patients that I've worked with where the parents said, well, you know, I've taken them to grief counseling, and, you know, they didn't really like it because they felt like, you know, they were sort of being forced to talk about it. And so I would be like, and so I'd say, okay, you know, let's just focus on your relationship with the child. And sure enough, what I found is that as we sort of focused on their relationship, over time, the child felt more comfortable talking about the loss. And sometimes it was a point, sometimes it was, they had to kind of get to the point where they felt like the other parent was ready to talk about the loss as well before they could talk about it. So I don't know, I'm sorry, I don't have like I don't have like a simple answer to that, because at least clinically what I've found is it's kind of a matter of just providing this space.
Thank you. One question is, how do you approach a parent who may be experiencing depression, but it's untreated? How do you approach that conversation, given that it may be impacting the attachment? That's a tough conversation to have. And the thing about the power of the attachment system is that I've found that often parents will do things for their kids that they might not do for themselves. And so some of the ways that I've approached that conversation is to say things like, you know, it seems like you're going through a really challenging time, and you're going through a tough time with your child. And what kinds of things are you doing to take care of yourself? And what kind of supports do you have to help you with this? And then as part of that conversation, you know, talking about that one potential support might be medication for them or for their depression, or therapy. So again, approaching it from the perspective of that, you know, I know that you want to do the best you can for your child,
And sometimes doing the best you can for your child is making sure that you're taking care of yourself.
Great, thank you. So it looks like we've gone through all the questions. Thank you everyone for an engaging discussion. We can now break for lunch. Oh, Dr. Emmon, did you have?
Yeah, I was wondering if I could just do a video for the baby wise question, but other people can log off. I just don't know if I can type it out.
Oh, yes.
Would that be okay, Dr. Troutman?
Yeah, absolutely.
And also, like, I can tell you what the Baby Wise book is, but I wonder what your thoughts are on. So Baby Wise, I've read it. It's a sleep book. And my perspective is, from a sleep perspective, it's trying to use entrainment where you say baby sleep schedule is this, then sleep. So pay attention to that entrainment and that schedule. But they partner that with cry it out at some point. And so I think the controversy, the good of the book that I like is it's talking about entrainment, but the expectations for babies to sleep through the night at 7 weeks is not realistic. And they need to find that golden mean between entrainment and attachment. And they've said like, oh, it's okay if baby cries it out for 30 minutes, which is not good for attachment, I would guess. What do you think, Dr. Troutman, with that book info?
Yes, that sounds like, yeah, so that's what Baby Wise is. Yeah, so in terms of, I mean, and again, with all these, I'm so glad that you're knowledgeable on that, because with all these things, I think it does come into kind of digging into the details. And in terms of like cry it out, one of the things that I will often talk to parents is, what do they mean by cry it out? Like you say, crying for 30 minutes. Yes, I would say,
Don't do that.
Right. And sometimes it's just a matter of saying to parents, how does that feel to listen to your baby to cry for 30 minutes? And most of them will be like, well, it feels horrible. And it's like, well, that's maybe telling you something then. But the other extreme is I've had parents who feel like they can't let their baby fuss at all. And so sometimes it's just a matter of kind of digging in and finding out. But yeah, if you have a video, well, everybody else can go to lunch, but if you have a video, I'd love to see.
Oh, that's okay. No, I just was saying, like, I get asked this question all the time. And so I'm very curious to hear your perspectives on cry it out with attachment. But I tell parents, I used to, like, when I was in training, there was this thing that said, well, if you let your baby cry for 32 minutes and then you finally cave and go in there, you've taught your baby that they need to cry for 32 minutes to achieve their goal. So don't cave. And then I have, since having my own children and working with patients and parents, I'm like, I can't stick with that like strict behavioral approach. And I just talk about, that golden mean between attachment and entrainment, and like a little bit of fussing, maybe, if it seems like, if you're thinking your child is just kind of fussing because they're half awake and settling themselves. But otherwise, we need to look at a little bit more gentle attachment, kind approach.
Mm-hmm.
Yeah. What do you have any other thoughts on cry it out?
So like I said, what I've learned, because from an attachment perspective, I hear cry it out and I go, oh. And I've learned to like take a breath when somebody says ask me about cry it out, and say, so what do you mean by cry it out? And if I heard what you just said about letting them cry for 30 minutes, cry hard. Crying for 30 minutes is different than like fussing a little bit. And I found that sometimes when parents say, oh, I'm going to do cry it out, what they really mean is letting them fuss a little bit.
I have a question about that.
Yes.
Sorry, this is just going to turn into the speakers asking each other questions.
We don't get to hang out enough anymore. No.